she is an ST1 in Obs and Gynae at Whittington Hospital, so inshallah she can take over.
Assalamu alaikum to everyone. As you mentioned, my name is Amal. I'm currently an Obs and Gynae trainee at the Whittington Hospital. First of all, I was very surprised but honoured to be invited to come and speak at this meeting, and I'd like to thank all the organisers to arrange this meeting to kind of prioritise so that we all kind of are aware of getting Islamic perspective alongside our careers. And it's good to see so many of you guys all here, and I'm sure you've all intended to come with the correct intentions, so may Allah reward you all, and may Allah make it easy for us to kind of take all of these points to kind of succeed, inshallah. So in my segment I'll just be talking about a little bit of my background after graduating from Bucks, my decisions into the reasonings why I chose to do obstetrics and gynecology, and also looking at the awareness that we need to be looking into the Islamic perspectives and legal verdicts alongside our careers, alongside our practice, and also balancing being a Muslim woman as well as being a doctor as well. So you recognise this place. It wasn't so long ago that I graduated from here myself, and I actually recognise quite a few faces from here. But after graduating in 2014, I initially went to Whittington Hospital, which is near Heathrow Airport, where I started my F1 job. So you yourself will get to do quite a variety of rotations. So I started off with cardiology, then general surgery, and then obstetrics and gynecology. And as you can imagine, being at Heathrow, we'll get quite a variety of patients coming in by their transits. Then I went to Ealing Hospital as an F2, initially starting off doing general practice, then again general surgery, and lastly A&E. And this is where I work currently as an ST1 in obstetrics and gynecology. So why did I decide to do obstetrics and gynecology? So I started to look into my field of interest quite early, and actually decided possibly to go into this field whilst I was a work experience student near A-levels actually, when I first saw a cesarean section. So I initially thought, wow, this looks amazing, and I don't think it was just a life-changing experience for the parents. This is our rota from last week. So I actually quite enjoy Obs and Gynae, considering it's very hands-on. So on labour ward, you can see at the top, so kind of assisting in deliveries, monitoring our ladies as well in regards to their progression, doing instrumental deliveries or any cesarean sections, gynae on call where you'll be doing various scanning, and maybe taking patients to theatres if there's an ectopic or evacuation of retained products. And then we cover the antenatal ward, seeing patients there and monitoring them, and then also kind of learning in regards to doing procedures such as elective cesarean sections. We do triage, so this is kind of the maternity A&E, and then we've got antenatal clinic or general gynecology clinic, so seeing patients on either end, and then again there's theatres, as well as kind of other subspeciality clinics. So for me, I kind of enjoyed it because it was very hands-on, but I'm sure you guys all have your own aspirations and what you would like to go into and what you enjoy. But apart from that, so it's not just the career that you enjoy. Certainly it's good to do something that you're interested in, but I would advise you to take it further. So me, myself, I'm, as you can probably tell, originally Somalian, and as you can see on this diagram, the maternal mortality in Somalia is one of the worst in the world. So inshallah, hopefully with the skills that I'll attain, I intend to eventually go to Somalia and hopefully make some sort of difference, inshallah. And so hopefully whatever career you decide to go into, whether it is general practice, ophthalmology, psychiatry, they can all have their benefits anywhere in the world, or even within your own communities as well. So I would advise you to use your experience, your skills, your standing within the community, and to kind of look beyond the career and the job that you have. Okay, as I'm sure you're all aware, our main aim in life is to worship Allah and worship Him as He deserves to be worshipped. So of course, it's important for us to know what is adequate worship, what is acceptable to Allah. And so you need to fulfill two conditions. So you need to have the correct intention, and of course it needs to be following the correct guidance of the Prophet ﷺ. Okay? And with that, me especially doing obstetrics and gynecology, you can imagine there's a lot of areas that you need to be aware of in my practice. And that will be similar for yourselves in whichever field you go into. So even though we may be reading a variety of books, the Cheese and Onion or whatever book you like to read, or the lectures you watch for knowing your medical practice, there's also a variety of fatwas and legal verdicts around medical practice as well. So for instance, for obs and gynae, starting from fertility treatment, whether it's IVF, going on to managing miscarriages, abortions, contraception, even performing cesarean section, there are a variety of legal verdicts that I should be aware of. And so even, for example, you may come across a Muslim patient and you'll be telling them the benefits and risks of the intervention that you'll be advising them to have. And they may come to you and ask you a different question that you weren't expecting, to find out what the Islamic perspective is. For example, I had a patient who had a miscarriage, a quite late miscarriage at 15 weeks gestation, and we had to, of course, manage her delivery. And she wanted to know, she could see that I'm a Muslim, of course, and wanted to know what the Islamic perspective is in regards to doing the funeral prayer, doing the sacrifice for that miscarriage, and things like that. And the rules and the information is there, so I would advise you to make sure that you read it around your fields as much as you read around knowing the benefits and risks for all of your evidence-based practice. So apart from that, of course, us doing medicine or becoming a doctor or whichever area you go into, I'm sure you guys all have the good intention, and that's why you're here, to also gain reward from doing this job. Okay? So as we mentioned, you need to have the correct intention, and inshallah you'll be rewarded for it. So, of course, being a woman, there's other responsibilities that you have around your life, not just your career. So I myself, I'm not necessarily married, I don't have children, so I haven't got those responsibilities for now. But I do know a couple of sisters, and so I've just got some quotes and some advice from them. So if we just go through it. So this is a sister I met as an F1, and she advised, I realized that although having a child during my studies was never part of my plan, it was always part of Allah's plan. We can plan, but He's the best of planners. My son was a gift from Allah. Today I am a single mother, a junior doctor, and a business owner of an aesthetic clinic. I am blessed to have the support from my family and childcare at the after-school club. My family all work full-time, but we manage one way or another. I wake up early and share the school run with a friend. I spend 2 to 3 hours a day with my son on weekdays, doing homework, playing one-to-one with him. How does she do that? Well, if it is it's a priority, you will make time. You just need to be time efficient and balance everything in life. If there's a will, there's a way. And Allah is the most great and most kind. He sends you blessings in the most beautiful of ways. Life is not a race for who will graduate the fastest, gets married the earliest, or buys the house soonest. It's a marathon, so pace yourself. As long as you are healthy, grateful, have faith, trust and love the Most High, determination to work hard, you can achieve anything you set your mind to. So mashallah, very inspiring from this sister. And this is another sister who's coming to join me as an Obs and Gynae trainee in a few months' time. And she's got, mashallah, 4 children. And so she mentioned 2 words: flexi training is the best thing since tea and milk. Secondly, sweet talk family into helping with childcare and reciprocate when they need care as well. Have plan A, plan B, and plan C when it comes to childcare, if nursery school is closed, etc. Don't put off starting a family, as medicine is a lifelong career. Honestly, Allah makes everything fall into place. I had 2 children during medical school at the end of 3rd year and at the end of her BSc year, and my other 2 children after foundation training. Not to exclude your career choice just because you have children, alhamdulillah, training is now flexible in all fields. Alhamdulillah, so many women in medicine now, and most will experience motherhood and will empathize with your situation. And of course, always inform your educational and clinical supervisor of your family commitments, as they will tend to be flexible and understanding when it comes to occasions when you're late or absent. Also important is for you to discuss your career plans with your partner. Their support is invaluable for your career and relationship. So another perspective from this sister. So for me, myself, even though I don't have those responsibilities, we all have responsibility, of course, as we mentioned, to worship Allah as best as we can. And yes, doing medicine and being in this career is something that can sometimes overwhelm us and distract us to kind of be, to compete with the next person, and to make sure that you kind of get all your equal portfolio done. But additionally, what I would advise you guys is to balance that out with Islam. Is what I do is to do small amounts of worship regularly, rather than you listening to this talk and being a lot more motivated, but doing a large amount in one go and then kind of losing strength that way. So for example, going to a sister circle once a week, or joining a class, whether it's tajweed, once a week, and inshallah that will maintain you to be regular, and inshallah learn as time goes on. That was overall just quite a slight summary of my perspective, really, and hopefully will motivate you to kind of look into what career path you would like to go into. Ensure that whatever you do decide to do, that you are aware of the Islamic legal verdicts around it, and of course remember the importance of our main aim in life is to worship Allah, and inshallah may He make our life a success in this life and in the hereafter, inshallah. I would say, me in comparison to the next speakers that will be talking today, I'll be the most nearest kind of in regards to academic training. So if we do have time, if you guys have any specific questions that you would like to ask, then feel free. Whether it is medical school stuff or foundation training, or what classes to attend.
ONG's trainings, they've all been committed to the new junior doctor's contract. Have you noticed any sort of, is that sort of noticed any adverse effects from that? Has it been put on it?
So you guys would have heard about the new contracts, and certainly can possibly affect quite a few people. I think in certain specialities, whether it be in GP or psychiatry, there may be some advantage. With obstetrics and gynecology, I would say especially for women, or people that are deciding to do less than full time, there may be a disadvantage, but they're still looking into it. where the new contract is where initially you would be kind of, in a sense, being paid as you progress every year, and it doesn't necessarily matter whether you change speciality or whether you extend that year as you're doing this in full time. With the new contract, you're kind of being paid per your level of training. So, of course, if you're going to remain in a certain level for a longer period, you won't necessarily get your pay progression. However, I think they're still kind of looking into that aspect. Me, myself, I feel that I'm getting a lot more money than I've ever had. So, to me, it doesn't really matter at all. And the hours that I'm doing at the moment, well, the rota looks probably a bit full. But alhamdulillah, I'm able to manage my time so far. So inshallah, as long as you kind of just organise, then it shouldn't be too overwhelming, inshallah. Any other questions? Yeah.
So obs and gynae has been your dream for a while, but have there been any times you felt burnt out, and how do you deal with that?
Yeah. Very good question. So I actually literally just finished Friday weekend on course. I was doing 8 to 8, so that was very long. So initially, as you start F1, F2, or your specialist training or locum, I would be apprehensive in regards to the job. You're going somewhere new, you're meeting new people, you don't know how the system works. Even now, currently, it's not like I'm a obs and gynae specialist, even though I've started out in this field. I've just done gynecology clinic this morning, and the patient isn't necessarily waiting for 4 months to come to clinic and expecting necessarily me, even though they don't know I've only just done the job. But my team are very supportive, so they know the level that you're at. So, and of course, I just read around my topic. And even though I did those long day weekends, you kind of have your team around you. So I've got a fellow SHO, 2 senior registrars. So you just need to ensure that you prioritize the jobs that you're getting to, get constant beliefs. Obviously prioritize according to the clinical need. And if you feel that you're unable to see, if you're having multiple acute conditions at the same time, then you're just going to have to raise it with a senior, or for example, I work a lot with midwives, so they are very independent, and I can just tell them, for example, we had a preeclamptic lady and blood pressure of 160/90. I don't know, in general medicine that doesn't sound too extreme, but in preeclampsia it will be quite severe. I can just tell them, give them a prescription of nifedipine, I can come in an hour, rather than having to worry to come acutely or things like that. Or a patient has chest pain as well, even though to be honest she was pretty well, I'll just tell them doing the ECG and I can come around soon. So you just kind of have to balance things, inshallah, and you'll kind of learn that as you go along. So I was initially apprehensive, but as you do the job, you'll pick up really quickly, actually, inshallah. Yeah.
You mentioned you want to go to Somalia.
Inshallah.
Just thinking, in terms of timing, what would be a good point in your career to sort of undertake that journey?
So that's a good point. At this point, I don't necessarily feel that I have a lot of obs and gynae knowledge, clearly, or in regards to kind of clinical practice, where I couldn't maybe interpret a CTG where we've got the maternal trace and things like that, but I wouldn't necessarily be able to act out on it and do the delivery myself. However, what I would say is don't limit yourself. Don't think, oh, I've got, leave it till 5 to 10 years when I'm a senior registrar or nearly a consultant, because considering the severity of how it is in these other nations, I'm sure any assistance would be useful. So I've heard of other people that will go in their early years of training, and some people might just go during some short periods in their summer holiday, and you can just kind of note what it is like over there and just kind of give that small assistance. For example, if you have a crash course on Lakewood, maybe it's just get the killer in, to be honest. So you could easily do that when you are in these countries to kind of assist in that way. So any skill is valuable in these areas. Even whilst I was at Ealing Hospital, in A&E we had one of our senior registrars there, and he's originally South African, and he would save all of the tourniquets that we would use for blood tests, because we would throw them away, but he would tell us, okay, give them to me, and he would take that to South Africa, because even the resources there are so lacking. So any kind of assistance I'm sure would be beneficial. So have that intention, inshallah, and obviously go whenever you are able to, and feel ready, but don't feel that you need to be necessarily fully qualified for them to kind of look at you for, to take responsibility. I'm sure any assistance is appreciated. Any other questions at all? Yeah.
Thank you for taking your time out to talk to us. My question is, what would you say to a lot of finalists right now, like just looking at my friends, and what would you say to us if I said to you that we'd be reluctant to take a job purely based on the rota? Like, because obviously you're doing, you just started your ONG training. A lot of us have very deep interest in certain fields, but we're reluctant to do it just because of the rota. We think it's too intensive, it's not worth it. What would you say to us though?
So, for example, you've received what in regards to the jobs that you may be receiving?
Not receiving, but just a certain field we're interested in, but we just don't want to do that field because we're just weighing up whether we want a life or we want to give our life to medicine or something. Just kind of weighing up the two.
Yeah, I mean, initially I suppose after, as an F1, you'll only be having a provisional license, so it's certainly kind of mandatory to have done your F1 year and ensure that you pass that year to kind of get your full license. After that, I suppose you could choose which job you go into. You don't necessarily have to do, I believe, the F2 that you've been allocated to. You could decide to apply somewhere else and do, I believe, what they call a LAT F2 and do the rotations that are given there. But in regards to if you find that the rota is too full on, I believe generally you would need to have sort of sufficient reason in order to do kind of less than full time in most cases. So I did have a friend who's doing her F1 and F2 over a 3-year period, possibly due to a condition or due to kind of care and responsibilities. But if it's specifically that job that you're not wanting, then I would, in comparison to the other jobs that you're allocated to over that year, then most importantly would be to speak to your educational supervisor, who's your supervisor for the whole year, and you could possibly swap that job. There were people swapping jobs. Any other questions? Yeah?
I've got 2 questions. First one is, have you ever found that you couldn't pray on time due to your schedule? And the second one is, what kind of things did you do to stand out in your portfolio to be accepted in Office and Line, because it's quite competitive for you?
Okay, so in regards to Salah, so definitely true. So alhamdulillah, we do have, even as a medical student or in my career so far, in every hospital I've been to, there is a prayer room accessible. In regards to how being able to be on time, of course that is very important to us, but yes, there have been times, certainly many times, where I've been late, and that would be most commonly during the kind of winter months where we've got to Asr Maghrib in kind of very close time frames. But in regards to Salah, as you guys know better, of course, if you've missed your Salah, if you've forgotten, what needs to be done is just pray as soon as possible. That's really the only answer I could give. You will be busy on your jobs, you'll have a list of jobs to do, but inshallah, the prayer rooms maybe just on that corridor, pop in, pop out, as best as you can. Alhamdulillah, it's not been too bad, but inshallah try to avoid for it to happen, but Allah knows best. You just try to pray as fast as you can, inshallah. And then your next question was about Obsangani specifically. Certainly, well, there are 3 people, Obsangani trust grade SHOs, in my current hospital who just went for their interview today, and they'd all done the interview previously. So, yes, it's not easy, but what I believe, Qadar Allah, whatever is meant to happen for you will happen. If you don't get it, it wasn't meant to be. So I always find content with that, whether it is your exams, whether it is anything that occurs, whether it's a good thing or it's a bad thing. So with Obs and Gynae or whatever you would like to go into, of course you would look at the person specification for that role and try to ensure that your portfolio matches all of the requirements that they are looking for. Whether it is that you've done team working skills, communication, teaching, done various basic practical skill procedures, things like that within your portfolio. And then inshallah you'll practice for the interview, and who knows what happens on the day. For example, in Obs and Gynae it's only a 45-minute kind of interview with 15-minute stations each, so 3 stations, which consist of your portfolio. So they ask you about, I guess, your level of training, your interest in Obs and Gynae, whatever field you would like to go into, your experience thus far. The other segment was communication skills. So in our one you had an actor, like in your OSCE, lady with a miscarriage. 2 segments to that to kind of explain to her that she'd had a miscarriage, and then talk about your management, whether it is conservative, medical, surgical. And then the other station was about prioritization. So they gave us 5 different scenarios with maybe some acutely unwell patients and maybe a patient that was pretty well, and you would have to kind of prioritize all of them, and they would see what you would do first. So it's obviously going to be, do your A to E assessments and things like that. What happens on the day, Allah knows best, and whatever result you get, Qadr Allah, so you just try your best. And if you guys are, whoever is interested in obstetrics and gynecology, I should give you my email. I'm happy to kind of send you whatever you need, or anything else you guys want to question about. Yeah. Any other questions? Yeah.
Just on the point of prayer, some people think it's alright to combine prayers if you're worried that you're going to miss them. Especially, for example, if you're on A&E and you've got a 10-hour shift, you're only allowed a half-hour break. The only option you can do is combine. But yeah, some people might have different views.
Yeah. So certainly that, I guess it depends upon which scholar or madhab or whatever you follow. So yeah, I did A&E and F2, and so you are doing those long shifts and don't have much break. So I don't know, maybe try to speak to the clinical supervisor, or it might be quiet at that period. Give it an attempt to see whether you can pop out. Otherwise, obviously, you try your best, really. I was sometimes able just to run out without anyone noticing, so it's maybe possible. Yeah, there's too many people in A&E, so they won't notice what's happening. It's hectic.
I think we're going to have to end it there.
Okay.
Does that make sense?
Okay, welcome.
Sorry to cut you off, but we have got 3 more to get through, so if you